Hi, I'm Dr. Darcy Dane. I earned my doctorate of chiropractic in late 1999 and then became a board certified chiropractic neurologist, more commonly known as a functional neurologist, in 2012. I'm thrilled to welcome you to the Naples Brain Center's Parkinson series. I have dedicated almost 2 decades to helping individuals with Parkinson's thrive through innovative, neuroplasticity driven approaches like functional movement training and cognitive wellness support. I just returned to my hometown of Naples, Florida, after spending nearly 20 years in Raleigh, North Carolina. And so, the Carolina Brain Center is now the Naples Brain Center. I'm passionate about empowering communities with clear answers and hope. And today, I'll address the top 10 questions you're searching for about Parkinson's, drawing from my own experience and the latest insights to guide you toward a proactive, fulfilling life. My goal is to give you clear, hopeful answers and practical insights to live well with this condition. So if you're ready, let's dive in with some optimism and plan to make a difference. Welcome to our journey to understanding Parkinson's disease. My goal is to demystify Parkinson's disease by addressing the most common questions people search for online. These questions often revolve around what is Parkinson's? What are its causes? What are the symptoms? How does it progress? And are there management strategies? Through this presentation, I will try to connect the dots between symptoms, causes, and solutions, emphasizing hope, proactive care, and neuroplasticity-driven interventions. Parkinson's disease is a progressive neurodegenerative disorder characterized by the loss of dopamine-producing cells in the substantia nigra, a region of the brain critical for movement and other functions. Dopamine, a key neurotransmitter, facilitates smooth motor control and influences mood, cognition, and motivation. As Parkinson's progresses, the depletion of dopamine and the involvement of other neurotransmitters such as serotonin, norepinephrine, and acetylcholine contribute to a wide range of motor symptoms. For example, tremors, rigidity, and bradykinesia. There are also non-motor symptoms, for example, depression, cognitive impairment, and sleep disturbances. Additionally, medications used to manage Parkinson's, such as L-DOPA, can further affect neurotransmitter imbalances, leading to a diverse symptom profile. Globally, Parkinson's disease affects an estimated 10 million people, but its impact extends far beyond those diagnosed. Families, caregivers, and communities are also profoundly affected, creating a ripple effect that touches countless lives. At Naples Brain Center, my commitment is to empower patients and their loved ones through education and support. Since 1999, my mission has remained steadfast. Change a life, change a family, change a community, change the world. The exact cause of Parkinson's disease remains elusive, with a multifactorial etiology involving both genetic and environmental factors. Genetic predispositions, such as mutations in the LRRK2 or GBA genes, account for approximately 10 to 15% of cases and significantly increase susceptibility. However, not all individuals with these mutations will develop Parkinson's, and many without a family history are diagnosed. This highlights the complex interplay of genetics and environment. Environmental factors, including exposure to toxins like pesticides, herbicides, and heavy metals, can damage dopamine-producing neurons in the substantia nigra, a hallmark of Parkinson's. Research suggests that prolonged or high-level exposure, particularly in rural or industrial settings, elevates risk, though not all exposed individuals will develop the condition. Repeated head injuries, such as concussions from contact sports or accidents, may also increase Parkinson's risk by causing neuronal damage in the brain regions critical for movement. Studies indicate that individuals with multiple concussions face a higher risk but lifestyle factors alone do not guarantee disease onset. What inspires me is the brain's remarkable ability to adapt through neuroplasticity. This is why interventions like neuroplasticity-based exercises, functional movement training, cognitive wellness support, and daily living strategies are so effective. At Naples Brain Center, I'm dedicated to helping you harness your brain's potential to manage symptoms and maintain an active, fulfilling life. Parkinson's is often associated with tremors, but its impact extends beyond hand tremors. Symptoms are broadly categorized into motor and non-motor types, reflecting the disease's complex effects on the body and mind. Motor symptoms such as tremors, rigidity, and bradykinesia, which is the slowness of movement, postural instability, and even digestive issues like constipation due to reduced gut peristalsis stem from impaired muscle control. Non-motor symptoms, including sleep disturbances, depression, anxiety, cognitive changes, and autonomic dysfunction, can significantly affect quality of life and may appear years before motor symptoms. Between the ages of 40 and 60, brain health can decline significantly, making early awareness of Parkinson's disease critical. Up to 90% of patients experience smell loss, and about 50% report depression and loss of joy before motor symptoms like tremors appear. So don't wait for that tremor to act. Other often overlooked signs include subtle instability or falls, constipation, reduced arm swing on one side, which can sometimes be mistaken for frozen shoulder, difficulty with smooth eye tracking, reduced blinking, difficulty looking up, and a less animated facial expression, so like a less vibrant smile. These prodromal symptoms, which can start years before motor signs manifest, are frequently missed or dismissed, delaying vital treatments. At Naples Brain Center, I emphasize early detection to address these signs proactively, enhancing brain health and quality of life. Diagnosing Parkinson's disease can feel like a puzzle since there's no single test to pin it down. As a functional neurologist, I focus on getting to know your story and symptoms to figure out what's going on. During a detailed neurological exam, I look for key signs like tremors, stiffness, slowness, or balance issues to make sure we're distinguishing Parkinson's from other conditions. I will also take a deep dive into your medical history, things like your work environment, say exposure to pesticides if you've been working in farming or industrial settings, or any past concussions, since repeated head injuries from sports or accidents can raise your risk for Parkinson's. My goal is to listen closely, validate what you're going through, and give you clear, practical ways to manage Parkinson's while supporting your emotional strength. Sometimes we may use a tool like a DAT scan to check for dopamine activity, but your unique symptoms and history are what really guide us. Preventing Parkinson's is tough because it is caused by a mix of factors: genetics, environmental exposures, past injuries. But there's hope. Research suggests simple lifestyle choices like staying active or eating a Mediterranean diet can lower your risk. I'm a big believer in neuroplasticity-based exercises, which not only helps manage symptoms, but might also protect your brain health. You can take charge by being proactive, especially if you're over 40 and have a history of occupational exposures, concussions, or a family history of Parkinson's. Annual functional neurological checkups can boost your resilience and improve outcomes. So even if we can't fully prevent Parkinson's, let's work together to try keeping you feeling empowered and in control. Figuring out if someone has Parkinson's disease or a similar condition isn't always straightforward, and it takes a sharp eye and a lot of listening. There's no single test for Parkinson's, so we have to look for those key signs like the one-sided tremor when you're resting, stiffness, slowness, and balance issues that show up later in the disease. Plus, we need to check for those non-motor clues like trouble smelling or acting out dreams, all of which are linked to Parkinson's underlying brain changes and Parkinson's often responds well to levodopa. A DAT scan can give us a peek into dopamine activity to support that Parkinson's diagnosis, but it's not the whole story. Other conditions can look similar but have their own quirks. Essential tremor, for example, causes shaking when you move, but not when you're at rest. And it doesn't come with Parkinson's stiffness or slowness or respond to levodopa. Multiple system atrophy hits early with balance problems, frequent falls, and issues like low blood pressure when standing, and it doesn't improve much with levodopa. Progressive supranuclear palsy stands out with early backward falls, trouble moving your eyes, stiff posture, and does not respond well to levodopa. Cortical basilar degeneration brings one-sided issues like clumsy movements, unusual limb behavior, or early memory problems. It also has some distinct brain scan patterns. Drug-induced Parkinsonianism is caused by meds like antipsychotics that can mimic Parkinson's with stiffness and slowness, but often resolve once the medication is stopped. However, there is a side effect called a tardive dyskinesia that can make things trickier. At Naples Brain Center, I'm going to dig into your story and look at things like work exposure, past concussions. I need to get the whole story. And then I can craft a plan that's just for you. So no matter how complex the situation is, the goal is to help you live a full and active life with strategies that can tap into your brain's ability to adapt. Parkinson's disease progresses through 5 stages, each presenting its own unique challenges. Could be mild unilateral symptoms to severe disability impacting mobility and daily life. This is where early detection, and particularly during that premotor phase, offers a critical window of opportunity for intervention. Stage 1 is marked by symptoms that are mild and unilateral, such as a slight hand tremor or a reduced arm swing. Patients are easily able to manage daily activities with minimal disruptions. Early interventions can help slow progression to stage 2. In stage 2, symptoms become more bilateral, and we see increased tremors, rigidity, and bradykinesia. This is going to affect posture, and it's going to slow tasks like dressing and eating. Balance remains intact, but tailored therapies help support maintaining independence. In stage 3, this is the midpoint, and this is where we start to see a lot of postural instability and slower movements, and this is going to increase your risk for fall. Patients can live independently but need assistance with complex tasks. At this point, medications like levodopa are optimized for symptom control. In stage 4, severe rigidity and mobility issues require assisted devices like walkers. Patients can no longer live alone safely and benefit from a multidisciplinary care program. In stage 5, we have profound stiffness and instability, which confine patients to a wheelchair or bed. And these patients are going to require a full-time caregiver. Care focuses on managing complications like swallowing difficulties and ensuring quality of life through palliative measures. At Naples Brain Center, I'm dedicated to supporting your unique Parkinson's journey with tailored interventions because everybody's path is distinct, and with early intervention and personalized care, I can help empower you to maintain function and quality of life for a longer period of time. When it comes to treating Parkinson's disease, or for that matter, multiple system atrophy, progressive supranuclear palsy, or cortical basilar degeneration, it's all about creating a plan that's uniquely you. Your medical neurologist might prescribe medications like levodopa to boost dopamine levels, or other medications if you're not responding positively to levodopa. Where I step in is with targeted functional strategies to help you live your best life. The cool thing about your brain is that it never stops being able to adapt, and that's thanks to neuroplasticity. So even though there is a loss of dopaminergic neurons, those remaining neurons can strengthen their connections to help make up for the deficit. At Naples Brain Center, I bring together a range of therapies to tap into that brain power. Here, we work on functional movement training to keep you moving smoothly, balance and gait optimization to lower your risk of falls, and swallowing and communication enhancement to support your speech and swallowing. Plus, we're going to teach you how to focus on daily living strategies to keep you independent, and cognitive and emotional wellness support to boost your mood and memory. If you're dealing with more advanced Parkinson's, your medical neurologist might suggest deep brain stimulation for relief. I'm happy to coordinate with all your healthcare providers to make sure we're all working toward the same goal. The earlier we start, the better, but here's the good news. We can still make gains in stages 3 and 4. Now, being proactive is key for everyone concerned about brain health, and I recommend annual functional neurological checkups for everyone over 40, and especially for those who have genetic or environmental risk factors associated with Parkinson's. With the right approach, many people with Parkinson's live full, active lives, and I'm here to support you every step of the way. Supporting a parent or spouse or friend with Parkinson's disease is a very meaningful way to enhance their quality of life, and it involves both practical and emotional efforts. Practical support can include things like attending a doctor's visit to help ask questions and take notes, or understanding a treatment protocol. You could also assist with daily tasks like meal preparation, dressing, or mobility to reduce the physical burden. You may help them organize a medication schedule, or you may set up a safe home environment to prevent falls, such as removing rugs. Emotional support is equally vital. You need to be their encourager by actively listening and celebrating small victories and fostering a positive outlook. Simple gestures like sharing a laugh or spending some quality time together can lift spirits. Beyond medication management, many natural strategies can complement treatment. Be an encourager of regular exercise, such as walking or Tai Chi, which research shows can improve mobility and balance. A Mediterranean diet, rich in fruits, vegetables, healthy fats, supports brain health. Activities like puzzles and reading can stimulate cognition, while mindfulness and meditation can help manage stress and mood changes. At Naples Brain Center, we emphasize education as a key to advocacy. Learn about Parkinson's symptoms, progression, and treatments to better advocate for your loved one during medical appointments or in daily life. Resources like the Parkinson's Foundation or local support groups can provide valuable insights. Your role as a caregiver is powerful. By combining practical help, emotional encouragement, and informed advocacy, you can help your loved one navigate Parkinson's with confidence. With the right support, many people with Parkinson's live fulfilling lives, and you're making a real difference every step of the way. Since 2009, I guess you could say I have become obsessed with how the brain works, how to rehabilitate the brain, and how to keep the brain healthy as we age. And of course, this has brought a lot of Parkinson's disease through my doors. At Naples Brain Center, my 2-hour initial visit offers a comprehensive evaluation, including a detailed review of your whole medical history, including occupational and concussion history, a thorough neurological and physical examination, targeted diagnostic assessments, and personalized trial treatments tailored to your unique needs. My approach centers on neuroplasticity, leveraging your brain's remarkable ability to adapt and reorganize. This innovative method, though new to some, has amazed my patients. Much like those I've worked with in Carolina Brain Center, or even during grand rounds when I was training to become a functional neurologist, a lot of patients wondered, can this really help? And the good news is that the results often spoke for themselves in just one visit. So take the first step toward a fuller, more active life and schedule your exam at Naples Brain Center today and discover customized strategies to support your brain's health. Parkinson's doesn't define you or your loved ones. So whether you have Parkinson's or you are a caregiver, join us at Naples Brain Center to start your journey toward changing the world one life at a time. Thank you for listening to this presentation. I hope I answered some of your questions and that you feel encouraged. I know you probably have more questions about how I can help, and I have always offered a free 15-minute phone consultation so that I can start off our relationship on confident footing. You can click the link on the page to be directed to the consultation form, and this form puts you on my priority callback list. I look forward to speaking with you, and don't forget to share this link with someone else searching for answers about Parkinson's.